Good afternoon, everyone, and thank you for joining us on today's webinar, all about Bupa and the Babylon digital GP offering for ECA members. During today's session, Hugh Wright, Operations Director at ECIS, Jon McFarlane, National Account Manager at Bupa, and Molly McNeill, Commercial Services Manager at Babylon, will help you find out more about the digital GP service provided through Bupa. Today's session will include an overview of the platform, the features you can have access to, and guidance on how to register. I'll shortly hand over to Jon to kick off the presentation. Then we'll move on to Molly's presentation, and Hugh will be on hand as well during the Q&A at the end of today's webinar to help answer your questions. You can use the questions box on your screen now at any time during the presentation. Our panel will answer as many of these as possible at the end of today's webinar. Lastly from me, today's session will be recorded and a full replay will be available on the ECA YouTube channel. That's at youtube.com/ECA Live. Be sure to also check out our wide range of videos and previous webinar replays covering all sorts of business-related topics. And with that said, I hope you enjoy today's session. And over to you, Jon.
Thank you, Emma. Good afternoon, everybody. Welcome to the webinar. I'll just have my camera on just so you can see the face, as it were. As you can see, I'm one of the most photogenic people in the world. So I'll go off camera in a minute just so I can concentrate. But welcome. I hope you enjoy the presentation. And just to sort of manage your expectations, because I'm sure you've all joined plenty of webinars before. My presentation only consists of 13 slides. So I'll obviously go through them as thoroughly as I can and appropriately as I can, and then we'll get on to some questions and answers. So I'll just take myself off camera for a second. Okay, so my name is Jon McFarlane. As Emma said, I'm a National Account Manager for Bupa. I've worked for Bupa for over 20 years, and I've worked alongside Hugh and his team at ECIS for, it must be coming up for 5 years. And although we're going to go through, obviously, hopefully some really useful information about private medical in general and how your scheme works and some of the services that we provide, it's worth noting that all details of the private medical insurance scheme are available from Hugh, because obviously there's only so much we can and want to go through today. So with regard to ourselves, I mean, Bupa is synonymous with private medical insurance. We've been in existence since 1947, and it's worth noting that population in terms of who's covered by private medical is about 10% of the population, but probably for the first time in a couple of decades, the demand for individual private medical insurance has actually increased because of COVID-19, which is a promising sign for that particular sector. But of course, we're dealing here with a corporate private medical insurance scheme, and there are some huge benefits about being part of a large organisation, particularly with regard to how much it actually costs, which we can obviously come back to at a later date in the Q&A. So the world has changed enormously. I was just mentioning to Molly, Hugh and Omar about, you only have to flick on the news, which I did a few moments ago, about the impact that COVID-19 is having in terms of the NHS and the waiting list. And the headline that you'll probably see today when you look at the news is that over 200,000 people are now waiting over a year for surgery. Now, obviously, the private sector works alongside the NHS. That's not our figures, that's the NHS. So, yeah, we're on to the next slide. So our promise, I mean, this is all about helping people live longer and healthier lives. And I just wanted to sort of paint an accurate, hopefully, picture of Bupa, because although we're synonymous with medical insurance, it's worth noting that we now only own one hospital, and that's the Cromwell in London. But our members have access to hospital groups such as the HCA, BMI, Nuffield, etc. And with regard to the consultants actually don't work for Bupa, apart from the ones obviously in the Cromwell, but obviously they are contracted to us and we work closely with them. On private medical insurance, just to give you a very broad idea about what actually is covered, because obviously there's a lot of terms and conditions attached to it, but in essence, private medical insurance is there to deliver and help members with acute treatment. So things like, a hip replacement, cataract surgery, which I had cataract surgery in 2020, just on a personal note. things like knee surgery, but we are there for the bigger items such as obviously cancer and heart conditions. But where private medical insurance tends to step away is for the long-term chronic conditions, and a good example of that would be asthma. Okay, Emma, on to the next page, if you wouldn't mind. So this slide tries to bring together a number of services that have really become very, very important to our members through the pandemic. Obviously, we're into the third lockdown, and it doesn't seem like it's ending yet. But what's interesting and different about the third lockdown is that, unlike its predecessor, the second lockdown, a lot of private healthcare services had to support the NHS. That hasn't really happened in the third lockdown, which is great for our members. So there was a period of time, sort of through March, April and June of last year, where a lot of private hospitals had to pass over ventilators to the NHS. They were there to help with obviously the number of patients that were going through the hospitals, but that hasn't happened this time around. But nevertheless, we found that, yes, there was a dip in claims, but we wanted to make sure that our members were aware that we were open for business. We've been able to maintain our high service standards. We've produced supporting literature telling people about what services are really available to them. And a lot of those are virtual. And probably if there's one positive thing that's come out of the pandemic for Bupa and our members and probably the industry as a whole is that it's moved us along from a digital point of view. And I know that Molly's joined us today to talk about our virtual GP offering, which is called Babylon. And obviously there are additional services that we've brought to the fore. And I think direct access is sometimes referred to as our triage service, but it's, in essence, I'll be coming on to this in a minute, it allows members to receive treatment and get on a care pathway which is appropriate for them without having to see their GP. And I think, you know, if I took a straw poll of the people on the webinar today, I'm sure some people will have success with regard to seeing a GP, but it's not a pleasant experience, having to queue outside in the freezing cold just to pick up a prescription, to go for a flu vaccination. I had to go for a blood test yesterday. It's not a particularly nice experience standing out in the cold and waiting to have your name called and going inside. But, you know, the availability of doctors is now on a virtual basis as well. And a couple of new services, again, which I'll cover on a bit later, which is our new skin pathway and cardiac service. So I think Bupa's equipped itself very well to support its existing members. And hopefully if there is anybody on the call today who's considering joining the private healthcare scheme for the first time, they'll be reassured to know that we're open for business. Okay, Emma, on to the next one. Okay, hopefully no one heard me turning the page of my notes there, but with technology and the sensitivity of probably microphones, you probably did do. So this is obviously talking about features of the scheme. Obviously, we should try and pull out the benefits to you as members of the scheme. Next slide. Okay, direct access. So direct access, I've mentioned already, is sometimes referred to as a triage service, and it's a service that's been available to members now for several years, and it allows members who have either a musculoskeletal, mental health or cancer symptoms to be able to talk to Bupa directly without having to see a GP in the first instance. Now, it's not compulsory. Members are obviously perfectly entitled to go and see their GP, but we believe that if we can encourage members to call our helplines and speak to us, is that you'll be clinically assessed that much quicker, less time off work, quicker recovery, and quite often, you know, you may have alternative treatment, maybe something a little bit less invasive. I know it might be a little bit controversial today, but if you did go to see your GP and they referred you on to a surgeon, then the chances are that surgeon will want to do surgery on you. And there are plenty of alternatives nowadays, particularly in the MSK field, where surgery may not be the most appropriate, because any form of surgery, even if it's something as small as a knee arthroscopy, you know, we want to avoid that if we can. So quicker recovery periods, yes, it's more cost effective for Bupa and the ECIS as well, but I think the most important thing is that it's fast and, you know, readily available to members, so you can make a quick recovery. Okay, Omar. Lovely, thank you. So how do you access the service? Well, as I said, you call us first before you see your GP. It's as simple as that. You've got a dedicated phone number with the ECIS, obviously, to allow you to take that initial step. And just to give you some sort of sort of a sense of a feel about what's involved. So if you were calling up for a musculoskeletal problem, you would initially be talking to one of our member services advisors, who would be passing you through to and booking you in to have an assessment with a qualified physiotherapist. Now that would normally take within 24 hours. So you would have your initial phone call, you'd be booked into the diary system, they would call you and clinically assess you. And that assessment could take anything between 20 minutes and 40 minutes, depending on the complexity of the case. And that physiotherapist would then decide with you what the next steps are in terms of treatment. But it's, you know, again, I'm trying to be devil's advocate. I don't want people to think this is a barrier to physiotherapy. Something like 70% of all referrals still go on to physiotherapy. But, you know, there could be alternatives available to you. We could be sending you some exercises and that might be able to help you so you can do some home help. And as we know, we're all at home at the moment, some limited exercise. So it doesn't necessarily involve physiotherapy, but it's not a barrier to physiotherapy either. On to the next slide, please. Okay, so one of the conditions that is available under direct access is mental health conditions, which, as we all know, having been seeing the news over the last year, it's front and center of everybody's thinking. You know, we've always taken mental health support very, very seriously at Bupa. We changed the benefit structure within the scheme a couple of years ago, and as you can see on the slide, hopefully everybody has access to the slide, that there are no time limits. We now cover more conditions than ever before, and there's ongoing support for members. And with direct access, if you come through that service, you'll be passed through to a mental health specialist to go through with you an assessment, and then would guide you on to the most appropriate treatment. Okay, next slide, please. Okay, and the third area of direct access, but also in general about Bupa as a whole, our cancer promise is very, very strong in the business. It's one of the few medical conditions which we all know can start in the acute phases where there's treatment that will actively take place, whether it be surgery, whether it be chemotherapy, drugs, etc. But ultimately some cancers, and thankfully there's very few of them, will actually get through to the palliative stage, whereby technically that's where they become chronic. But Bupa has always maintained a very strong public stance that we'll be there to support our members literally from the start to the finish, which is why this particular page talks about living well with a cancer, and we've also, you know, we want people to make a full recovery. So direct access can lead you to our cancer support, but of course you can go to see your GP. You'll be able to speak to a specialist oncologist nurse, and if necessary, give you some support with regard to counselling. Another one of our key differentials in the marketplace is that we've been supporting our members who have children who may have cancer themselves, or maybe the children are at home with a parent who's got cancer, and those books are available from Bupa in terms of helping and support the little ones as well. But at a very high level, you know, our cancer promise is strong in terms of there's no time limits, there's no pound and pence limits. You'll have access to the best, nice qualified drugs in the marketplace. And although, you know, cancer treatment, I believe, has been largely unaffected by the pandemic, unlike musculoskeletal, you know, you can still receive treatment for this obviously devastating condition. Okay, next page, if I may. Okay, just on to a couple of new services that are available to members this year, which you may not have heard about. So one of the, well, there's two I'm going to go through. The first one is about mole scanning, which is quite interesting. First of all, it's important to know that it's, you know, safe from a member's perspective. You need to call obviously the helpline, and as we know, a lot of people do have moles, and sometimes even when we are allowed outside, you know, that they can sometimes react to the sunlight, and we want to make sure that people don't let things go unchecked. So even from a remote basis, you can call us. We'll need to get your acceptance to join the skin analytics pathway, and we'll actually send you a special camera with a special lens to actually take 2 or 3 pictures rather of the offending mole, which will be returned to Bupa and our clinicians so they can be assessed. And when we've actually got those pictures, we can then decide the next course of treatment. But it's COVID safe, which is very, very important. It allows you onto a pathway which is very, very good. And although there is a costing mentioned on this slide of £51, that's not £51 to you as members. That's obviously a cost that is borne by the scheme as a whole. If you do require that, it represents great value for money from our point of view. And hopefully it will lead to less cosmetic surgery being required. We've got national coverage as well. And I think it's all about the speed of treatment. So hopefully that will be of great interest to people if they do have a worrying mole. Okay, next slide, please. Okay, a bit of a messy slide, this one, but this is about our new cardiac assessment. Now, this is one of the, unlike the previous service, which is the mole one, where you can talk to us on a direct basis or go and see your GP. You'll probably see that on this slide, you have to see your GP, so that when they refer you obviously on for further treatment, you call us to get talk to the cardiac support team, and you obviously have to agree to join the rapid assessment service. And obviously, as a result of that, you'll receive a video consultation with a consultant who will discuss the findings. And it's quite interesting that you can actually have a number of tests sent to you at home, so that the video conference you have with the consultant is more meaningful. And hopefully a lot of those will be false alarms and people will be discharged. But obviously for the more serious conditions, you'll be referred on to perhaps having some treatment. But again, it's all about giving you access to fast, effective treatment. Yes, this one does rely on the GP referring you. It's COVID safe. And hopefully if we can get you on the right care pathway, you know, if you do need to have any surgery or treatment, it will be caught at, you know, your condition will be caught at an earlier stage, so it'll be less invasive, as it were. Okay, next page, if I may. One of the unsung heroes about, I suppose, Bupa is the 24/7, 365 days of the year Bupa Anytime Healthline. I couldn't help but notice that the NHS has started to advertise, I think, the service 111 on TV again, trying to encourage you know, the UK population. Here we're talking about the Bupa population, obviously, giving you access to 24/7 health advice, you know. And the examples they talk here about is, you know, if you've got a child who's been ill in the night, or you want some help with regard to travel vaccinations when we can actually return to travel, or weight management, etc. So you can actually call 24/7, and even if you're the policyholder, you could actually be ringing up on behalf of maybe a spouse or a dependent, because, you know, we want people to feel comfortable about coming to us and just asking general health questions. It's a clinically run service led by a team of doctors and nurses, and as I said, it's available 24/7, 365 days of the year. So a great service. And we've noticed that through the pandemic, some of our services have gone up in terms of popularity, and we're coming on to that with one of those, which is Babylon. Anytime Healthline, the usage has gone through the roof in terms of people wanting help and support. We've noticed things like, if I go back a few slides, like the MSK pathway, actually the numbers did dip away, actually, because one of the things we have noticed is that whilst cancer and mental health treatment have been unaffected, a lot of postponed surgery happened last year. And when we compare our data from 2021 to 2020 and 2019, we know that there's a lot of surgery, even for private patients, which is still yet to happen. Now, I don't know whether that's a combination of availability at hospitals, but I sense that there's probably still a degree of nervousness about coming to hospital and going into a physical setting. But, you know, the hospitals have made massive improvements in terms of when you do go to hospital, when you arrive, you know, in terms of your appointment, how safe the environment is. You know, they want to make sure that the pathways in terms of actually around the hospitals, you know, you're not going to be bumping into people. So it's a very safe environment. So if there's anybody on the call that does need to have treatment, you shouldn't feel uncomfortable about ultimately going to hospital. Next slide, please, if I may. Last couple of slides. So that wasn't a prompt just for you, Molly, but just a reminder for the audience that my presentation is shortly coming to an end. This isn't a brand new service, the Family Mental Health Line, but it's an important one I wanted to make members aware of today, because, you know, working from home, and again, one of the common discussion points on the TV, which no matter what channel you're looking at, is about homeschooling, and about the pressures on parents, but also let's not forget about the pressures on our children as well. You know, they're missing their friends, they're in a different environment, they're probably equally frustrated. But on a bigger scale, you know, when you look at the slide on the right-hand side, the number of children that are reporting problems in terms of social media, you know, a lot of pressure on them in terms of, you know, photographs, people making comments about posts. You know, our kids face massive problems compared to some of the things that we grew up with, and perhaps sometimes as adults we can't sometimes get our head around it. But it's important to know that the family have a mental health line that is there specifically to support children, because, you know, they are members as well. Okay, next slide, which I think is our last one actually. Okay, Health Hub. So if you've never gone onto a Bupa website, I'm sure it's probably not the first thing you think about when you want to go on the internet. It's probably Amazon or Google or something like that. But in terms of healthcare, it's a very, very popular website, not just because of our size, but also just because I think people recognise our trusted brand, about a great place to come to for information. Although we major on some of the subjects that I've talked about today, which is mental health, cancer, and MSK, and heart conditions, you know, we've got an A to Z of information about all the different types of healthcare problems that you can have. If you need to find a local consultant for you, you know, there's a consultant finder information on there. So there's a wealth of information on our hubs and website. And although we try not to be too directional, I think it's important to know that, you know, our finder will also show you things like hospitals as well as consultants, and also dental practices. Although I haven't mentioned dental at all, you don't have to have insurance with Bupa to go to a Bupa dental clinic. We own something like 500 in the UK now. You may well live near one quite close by. I just wanted to mention that or reference that just in case you saw one on the high street. But I hope you've enjoyed the presentation. I appreciate it's quite high level. If you've got any specific questions you either want to ask now online, feel free to do so, or field your questions directly to Hugh, and I'll be more than happy to help you. But thank you very much for your time, and over to you now, Molly.
Great, thank you so much, John, and thanks, Omar, for this slide. So, yeah, as John said, my name's Molly, and I am a Babylon account manager looking after yourselves and lots of other clients, along with John and Bupa. We go on to the next slide, please. Perfect, just a quick agenda here. So to begin with, I'll do a quick brief introduction of Babylon. Then I will do an overview of the service. Next up is how we work with Bupa. Then some patient testimonials, the all-important how to register, and I'll touch upon coronavirus at the end. Perfect, so if we go on to the next slide, and one more again, thank you. So at Babylon, we really are a company who is driven by our mission. Babylon believes in making healthcare accessible and affordable to every person on Earth. By putting a comprehensive health service into the devices that most of us already have, and that is the mobile phone, that solves that first accessibility part. The affordability part, though, is much harder. It still costs us as much to put a clinician behind a screen as it does in real life. Of course, with the same experience and training of that clinician being required. However, it is the technology that underpins our services that allows us to succeed. If we go on to the next slide, so since about 2013, Babylon has grown exponentially, and we now operate in many countries globally, often working with local governments and health insurers such as Bupa here in the UK. You'll see lots of numbers on the slide there, but I suppose the one that I would particularly call out is that 94% 4 to 5 star rating. That's something that we're really proud of, and we hope that you have a great service with us too. Just whilst we're looking at this at the globe here, I'd just like to point out that Babylon is a UK-based service. However, you can download the app and have a consultation with a UK GP whilst abroad, but there are a few exceptions. So my advice here would be when you have your consultation, just let the clinician know where you are and they'll be able to best advise you. Of course, particularly with prescriptions, for example, it's always best the clinician knows where you are to be able to give you the best advice. That's great, thanks very much. If we go on to the next slide, and the next one after that as well. So what is Babylon, I guess? So Babylon is an end-to-end service, supporting you both when you're well and also when you're not. So we have features here ranging from early symptom checking through to ongoing health monitoring. And this allows you to develop a secure clinical record of your health information, which is shareable with your own GP. One thing that I would quickly note is if you do have a consultation with Babylon and you would like the notes shared with your NHS GP, then please just let the clinician know and they'll be able to do that for you. If we go on to the next slide, this is our AI chatbot or symptom checker. So this is the first feature that you have access to through Babylon. So this is a text-based medical device, which is supposed to replace that normal Google search that, let's be honest, we do all rely on. It's ISO certified, allowing you to base your answers off real medical knowledge. So you can input any symptom or any health question, and it safely triages you to the next best course of action. And then at the end of the chat flow, you have the ability to text a doctor, attaching a photo or a description, and the doctor will text you back within a couple of hours. So you'll see on the screen there, this user clearly has a headache. And then at the end of the flow, once they've answered a number of questions on the right-hand side there, it looks like this user potentially has a migraine. And because of the answers given, we suggest that they see their GP. Of course, this is just one option of outcomes on our chatbot service. If we go on to the next slide, thank you. Our consult with a doctor feature is probably what we're best known for. With Babylon, you have the ability to have a consultation with an NHS registered GP, and you can do that 24 hours of the day, 7 days of the week. So we will open all over Christmas and New Year, etc., and we'll continue to be going forward. It's worth mentioning here that you don't have to deregister from your existing doctor. So this is an additional service provided to you through your Bupa private medical insurance. You can book a video or a phone call appointment through the app, and you can typically get an appointment in under 2 hours. Our GPs are selected based on their communication skills. They also, though, have to have worked with the NHS for a minimum of 5 years. And as I showed at the beginning, that 94% 4 to 5 star rating. So once you have had your consultation, you are welcome to review it and let us know how it went. That's great, thank you. If we go on to the next slide. So the next feature is our prescription service. So just like any medical body, Babylon GPs can prescribe patients medication. And your prescription can be delivered to you for free anywhere within the UK. If you're in London, the medication will be ready on the same day. And if you're outside of London, it can take up to just 1 day. And you can have your prescription delivered to you wherever most convenient. So at the moment, it could well be at home, but otherwise it could be at your workplace or in fact your local pharmacy. So you'll see on the screen there, this user's local pharmacies are highlighted in purple, and they can choose which one they would like to go to collect their prescription. Worth noting here that delivery for our prescriptions is free of charge. The prescriptions themselves, though, are private prescriptions. So you will pay for the cost of the drug itself. However, we have found that most of our most commonly prescribed medications do fall below the £9 NHS price cap. But you can always ask your clinician the most cost-effective place to pick up your medication, so there's no nasty surprises there. Thanks so much. If we go on to the next slide. So our consultations, as I'm sure you've gathered, are virtual consultations, but there really are always going to be times where you need to see a physical doctor. And Babylon GPs can offer you referral letters, and these will be delivered to you following your consultation. And these are open referral letters, so they can be used with Bupa if they're your private medical insurer. Thanks so much. If we go on to the next slide, and one more. So Babylon is provided to you in partnership with your private medical insurer, Bupa. For some conditions, as Jon has highlighted, such as mental health and musculoskeletal problems, you're able to get a referral without speaking to a GP first through Bupa's direct access pathways. However, when you are in need of a referral, then please remember that Babylon is one of the options where you can get that open referral to then pass on through to Bupa. Because we work so closely with Bupa, our GPs know when they're speaking to a Bupa patient, so this just helps them to be able to give you the best recommendations in terms of your next steps. Thanks so much. If we go on to the next one, and one more. Thank you, Emma. Perfect. So you'll see here a number of testimonials, and I won't go into them too much. I suppose it's probably fairly obvious that the most common feedback that we get for the service is that it provides fast access to a clinician. The benefits of being able to get a prescription delivered to you wherever is convenient is, of course, very helpful. And also on our excellent clinicians themselves. Of course, getting this service as part of your Bupa private medical insurance, the option to receive referral letters is also a big plus. Thank you so much. If we go on to the next one. Perfect, thank you. So to use Babylon, all you need to do is download it from the App Store, or in fact on Google Play, or otherwise you can use it online. You need to register with your full name exactly as it matches on your private medical insurance policy. And I would really highlight that if you are having any difficulties, please make sure that your name matches. Perhaps go back to your policy and just double check the exact name that you've used on that. You don't need to add your email address, and that can be any email address, so your work email address or your home email address. And then your unique client code, and you can see that on the screen there in front of you, ECIS PMI. We do encourage you to download the app ASAP. That then means when, unfortunately, you do become ill, you're not having to download an app and try and find this code, etc., but in fact, you have really easy access to a doctor. Thanks so much. Next slide. Perfect. So this one's just to say, don't worry if you've already downloaded Babylon and signed up. You can go to the Me tab on the bottom right-hand corner of the screen. Click Membership and Membership Type, and then you can add your code there. I'd also highlight here that it's anyone who has a Bupa policy or any of the dependents or partners on your policy have access to Babylon. Anyone who's over the age of 16 can download and use the app themselves in exactly the same way that you do. So to type in the code, email address, name, etc. If they're under the age of 16, then they will need to be added to one of their parents' accounts. And to do this, you go to the Me section again, so bottom right-hand corner, and go on the Family tab, and you can add them there. If you do have any questions or issues with signing up, or just more generally about the Babylon service, of course, other than the end of this session, please don't hesitate to contact our support team. And you'll see the details on the slide there, so the email address and the telephone number, also very easily available online if you need them. Perfect, thanks, Omar. Perfect, and one more. Great. So here you can see a few of the things that Babylon are doing during the current coronavirus pandemic. We've introduced some changes to our symptom checker and list of diseases, and the symptom checker is that one that I highlighted at the beginning. And we regularly make sure that that is up to date. We've also recently added on the ability to see a few other clinicians, so including a prescribing pharmacist and an advanced nurse practitioner, and you can see the full list on the app. We also have published a range of videos and other articles which are accessible through our coronavirus blog, and also our monitor and mood tracker, which encourages you to look at preventative care. You're able to sync your wearable devices and other health app information into one place. And this is really useful for the GP during your consultation too. Perfect, thanks Omar. If we go on to the final slide, so that's it from me, and I would just see if there are any questions. Just on the slide there, you'll see that all important code again, and the email address and telephone number. Thank you so much all for listening.
Thank you, Molly, and thank you to Jon for your presentations there. Great overview of the Bupa and Babylon service, which is of course an ECA member offering as part of your ECA membership. Just before we launch into the questions, you will have seen a few links to different resources throughout the presentations. Obviously, you wouldn't have been able to click those. However, those links will be available beneath the YouTube replay on the ECA YouTube channel. So all those resources will be there just beneath the video in the description there. So straight into the questions, and we've also got Hugh from ECIS on hand to help us with the questions. So I'll put this to the general panel because I'm not entirely sure who is best placed to answer, but regarding the 24/7 healthcare number for Bupa members and their families, this person asks, what information will they need to provide to access the service?
That's probably me then, isn't it? I'd imagine. So that is the health line, like you say, the 24/7, 365 days of the year. So when you call up, you'll be asked to provide your name, obviously date of birth, address for data protection purposes. Ideally, it'd be nice to have your registration number, but beyond that, you shouldn't really have to disclose any further information, certainly not medical information, unless it comes through a conversation that you have with a nurse or a doctor.
Okay, thank you.
Okay.
We have a question now from, it looks to me like an employer who offers Bupa to their employees. They ask, can you let us have some literature to send to employees, please? So where's the best place to find that sort of literature?
So there's literature available to all employers through the ECIS Canopy system, which is the online administration portal that all employers have access to. If you go to your forms and guides section on there, then you can find a wealth of information about the scheme, including about Babylon. If you want anything specific, then feel free to drop me an email. My email address is hugh.wright@ecins.co.uk, and I'll happily respond.
Thanks, Hugh. And of course, that information will be made available with the replay as well. So those are actually all the questions that we had from the audience, and it doesn't look like any more have come in. So I'll open it up to the floor if you wanted to add any more kind of closing statements. If not, then we will wrap up the presentation there for today.
I'd like to thank Molly and Jon for some engaging and interesting presentations. Thank you. And just to reiterate the availability of Babylon to all members of the PMI scheme, it really is a fantastic addition to the private medical service that's available. And so I'd encourage all members to download the app, and as Molly said, get it set up before you need to use it, which hopefully you won't. But if you do, I can have some personal experience that it's a really good service.
Thanks so much, Hugh.
Great, thanks.
And thanks everyone for joining.
Thank you.
Thanks very much.
One more question.
Oh,
Sorry, just before we wrap up, we've got one more, and I suppose it's a good point. So when people are looking for the app, what do they actually have to search? What's the exact name that they have to search to download the correct app?
Yeah, no problem at all. So it is called Babylon. There could be some letters after the app. There sometimes is. There's sometimes kind of, you know, your digital GP or whatever it may be. I'm just going to double check now in the App Store what exactly it's called currently, but it is normally just Babylon. Let me just, sometimes if you search it, other things can come up. So there's something else that pops up at the top as an advert at the moment, but we're Babylon 24/7 appointments, and it's got our logo on there as well. So you should be able to see it slightly just there, but it's Babylon. If you type in Babylon to the App Store or Google Play, etc., you'll be able to use us there.
Great, thank you, Molly, and good point there. Okay, and it looks like that's all the questions we have for today. So once again, thank you to our panelists, and thanks to those of you who joined us today. And keep an eye out for that replay on YouTube with all the extra resources and information in the description. And thank you, everyone, and have a great rest of your day.
Thank you. Cheerio.
Thanks so much. Bye.
Thanks.